name is Heather Lieberman. This is my first video for my nursing care class, course number VTHT 2439, section 31420, and my student ID number is 3309588. Hope you enjoy my video. Alright, in this video I'm going to demonstrate sculpting the heart and the lungs. So I'm going to start with the heart portion of things. So when listening to the heart, some things is you want to start on the left side. That's where you're going to hear the pulmonic, the mitral, and the aortic valves. And then on the right side, you're going to hear the tricuspid valve. While listening, you want to listen to the rhythm of the beat. You want to listen to how hard that beat is, or how hard the beat is, meaning the quality of the beat. So I'm going to start kind of listening to him. I'm listening for any abnormalities as well, such as murmurs, which would sound like a whooshing noise instead of a lub-dub noise. And then anything that's, again, just a dysrhythmia, so just an irregular heartbeat. There is a type of arrhythmia that can be normal in dogs. That's called a sinus arrhythmia, where when they inhale, it actually speeds up their heart rate and then it slows down until the next breath. That's a normal thing in dogs, but abnormal in cats. A normal sinus rhythm is normal in dogs and cats, and then sinus tachycardia can be normal in cats as well. So when I go to place my diaphragm and my stethoscope on him, I want to go for the fifth intercostal space. That's about where his elbow is going to meet his chest. So I want to aim for this area right here. I want to count for 1 minute to get my beats per minute. That can also be done by counting for 15 seconds and multiplying that number by 4. So I'm going to go ahead and demonstrate that really quickly. So I did actually get about 30 beats per minute there, or 30 beats per that 15 seconds, so I'd multiply that number by 4 and that would put me at 120. Okay, so that is kind of listening to the heart rhythm, and then moving on to the lungs. So when I'm listening to the lungs, I'm listening again for any abnormalities that I'd want to let my veterinarian know. Things like that would be things like stridor, which is a high-pitched wheezing noise. Stertor, which is a low-pitched snoring noise. Any whistling, popping, cracking, or absence of lung sounds are something that would be concerning. I would definitely want to let my veterinarian know of that, and if it took a minute before they were able to assess the patient, I might even want to start some supplemental oxygen therapy to them. While listening, I'm kind of dividing the lateral side of their chest here into 9 boxes, and that's where I'm going to listen to assess all of the lung lobes. Reasoning behind that is certain areas of the lungs can be affected where others are not, so I don't want to miss anything. So I'm going to go ahead and demonstrate that on Mr. Vader here real quick. I know, oh boy. So giving yourself enough time to kind of assess the breathing, so if you need to sit there for a couple breaths in each spot, just so you can actually make sure you're hearing things properly. But I think that's everything for as far as the sculpting the heart and the lungs. Alright, in this video I'm going to demonstrate using a catch pole or a rabies pole. So with this I have kind of my end piece here. This is my hand loop, where I would be able to pull this loop down here around the head. I do want to maintain distance from the animal that I'm using this on, considering they could be fractious, meaning they want to bite me or eat my face off. Also, they could be rabies suspects, so we don't want to be bit by any of those given the transmission of disease there risk. Again, we're going to use Mr. Vader here today to demonstrate this. When you're approaching an animal using one of these, you want to stay behind them. You don't want to be in the way where they could potentially snap at you and kind of, I know buddy, sneak this over the head. It's okay. If they start to panic, you want to loosen that because you don't want to harm the animal. And then we do want to kind of, again, keeping my distance, come on, this way. We want to get it up behind the back of the head there. So there, got them nice and tight. I want to keep my distance, so I am trying to maintain this and then keeping my control over him. Okay, and he's kind of twisting, so I did ease up a little because, again, I don't want to hurt him, but I also want to keep myself safe. So using this pole, I'm able to kind of, maintain safe distance, maintain control over the animal. So that way, if needed, we are able to do that. So now I'm going to loosen this up and let him be free, and that is my demonstration of using a catch pole. Alright, in this video I'm going to demonstrate cleaning a cage. There are some important things you got to consider when you are cleaning a cage or a run, whatever it may be, and that is contact time. So for this product actually, which I'm using this rescue product, on the bottle it says depending on what you're trying to kill, but basically I'm going to go for that 1 minute because the timing kind of just builds up to that. So for this product it's a 1 minute contact time. I know at our hospital we had been using another product for a while that was a 10-minute contact time. So always something important to consider. And then basically if there are any soiled linens, anything in your cage, you want to remove those. If there was anything like stool or urine, you would want to kind of clean that up somewhat before going for the disinfection part. You want to completely saturate all sides of the cage, and that the contact time, it needs to be wet in the cage for that to work best. So I'm going to go ahead and spray down. Really saturating everything in here. So I'm going to let that sit for a minute. Obviously for video purposes I probably will skip along a little quicker. I do want to mention too this cage door. So what would ideally be done is this can actually be pulled off. And what I would do is take that over to our little scrub tub, spray it down with my cleaner, let that sit for a minute, and then scrub it down, and I could rinse it then. And that would remove any debris from the animal pawing or whatever at the cage door. Alright, so when I go to clean this, starting with some fresh paper towel here, I want to start from the top, do my sides, and then work to the bottom. Reason behind this is if there was any kind of soilage at the top, we don't want that falling down onto a clean bottom here. So I'm going to go ahead, work my way back to this back side, scrubbing away anything, and then kind of flipping your towel as needed or replacing it if it's starting to get some soil that's on there. Okay. And then that one's kind of wet more. And I'm finishing here with the bottom. Kind of pulling all of that debris forward to me, and that would be the finish. And like I said, ideally you would wait a minute before I went ahead and did this, but for video timing I just went ahead. So that is how you would clean a cage. Alright, in this video I'm going to demonstrate doing an anal sac expression or anal gland expression. I have kind of all my supplies here, so I have some lube, some baby wipes, waterless shampoo, and a little bit of doggy body splash to use afterwards. The anal sacs kind of reside around, if you're looking at this like a clock face, around 5 and 7 o'clock, so around here. So I'm going to go ahead and get started here. I do want a couple of these baby wipes just to catch that fluid in. And I'm going to lube my finger up here just to make it a little nicer for later. It's a little easier on things. Got my restrainer Katie helping me out, so I'm going to go ahead, enter in. Oh, relax, buddy. Relax. Okay, and then kind of stabilizing it with my thumb and my finger in there. It's okay. And we're milking it out a little bit, so squeezing, getting some debris. It's a little chunkier, and sometimes that can be a reason why patients actually need their anal glands expressed manually by us, because they aren't able to do it on their own. I have not, it's okay, Peter, it's alright. I have not mastered the one hand expression yet, so I'm gonna go back in. That was his left side. I would say his left side was small, pretty easy to express. Always something you want to document in their charts when you're expressing. This one even smaller, like a pea. And again, kind of whitish fluid material there. And if anything were abnormal, like bloody or kind of pus colored, I would definitely want to alert my veterinarian. But other than that, I'm just going to clean him up, and then we'll call this good as far as that anal gland expression goes. So always cleaning your patients up, making sure they walk out smelling good, because anal glands can be very stinky, or generally are. Okay, and that's how we express our anal. Alright, in this video I'm going to demonstrate applying a topical medication. Today I'm going to be applying this Frontline onto Nini here. And it just depends on what kind of topical medication you're using. Depending if you need to wear gloves or not. For this medication you don't need to. And so I'm going to have my restrainer kind of distract her here. The important thing for this medication is you really want to get it down onto the skin. And of course she has kind of short hair that doesn't part very easily. So I'm going to try to make the best part I possibly can. She's enjoying it. So with this medication, I do have to just kind of snap that to make it open. And I'm finding my good part here, and I'm applying it down onto the skin. I want to go on the back of the neck here. Trying not to touch too much of it, obviously, as I'm doing it. It can be easier doing more of a vertical kind of part with this little short hair here. I'm finding it a little easier just to get it like this. So I'm applying down onto the skin, back of the neck area. This is especially important for cats. Okay, that's the entirety of the tube. Especially important for cats because you don't want them to be grooming or licking that medication off their neck. So that's always something to consider when you're applying a topical medication, making sure that the pet's not going to be ingesting it. So that is how you apply topical medication. Alright, in this video I'm going to demonstrate cleaning a dog's ear. So I have Nini here as well as my supplies. So I got some gauze, some Q-tips that I'll use just for the crevices or the part of the ear canal that I can see. I do have her medication. We have an antifungal here that we're using. And then we have her ear cleaner here as well. So I'm going to bring all this a little closer to me. And then I got a little squeeze cheese here for our girl. Again, kind of low on restrainers in our hospital. So very busy, so kind of going to do some of this, help distract her. So again, I don't want this to be touching her ear. Holding that pinna up to help flush that down in there. Good girl, tolerating it. It gets a little messy sometimes, so little drips aren't too bad. Oops, hang on there, girlfriend, getting carried away. Alright, so massaging the base of the ear, working that down in there. Good girl. And then I know, shake it out. Bring that cleaner up, huh? And now I'm going to bring that cleaner, or wipe that cleaner out. Getting my finger down in there, pulling out debris. I want to do that until I'm not getting so much debris. Good girl. I know. This is like a never-ending piece of gauze right here. So wiping, getting much cleaner here. I might just use this in some of this. Now if I were to get any blood out, I definitely would want to stop and not irritate the ear further. I know. Are we out of cheese? Oh my goodness. You can't work for free, huh? Good girl. So again, just getting that little crevice, and actually I did get a little blood there, so that means I'm going to stop because I don't want to further irritate the ear. So now I'll apply my medication. Sometimes medications can be administered the amount of drops that we want to do. For this one, we're just putting a liberal amount in there. So I'm just going to give it a nice good squeeze. Again, not touching the ear itself. So just giving a nice little squeeze. I know it's cold. And this one I kind of can count some drops, but again, just a nice amount. Work it down in there. Good girl. And then that is it. This medication we do want to keep in the ear, so no wiping. And then ideally I would have waited about 20 minutes or so before applying that between cleaning. Okay, so that is cleaning and medicating for a dog. Alright, in this video we're going to demonstrate doing a kitty cat ear cleaning as well as medicating. So I have my ear cleaner here, my ear medication. I have some gauze, cotton balls, and Q-tips. Q-tips we don't want to put down into the ear. That is more for just cleaning crevices or visible areas within the ear canal there. So I'll get started here. Sometimes it is nice to have a restrainer. So currently we're kind of low on restrainers. Louie's pretty good here, so hopefully we shouldn't need any help. To start, I do want to kind of lift that pinna up. That is going to help elongate and kind of help that fluid go down into the ear canal well. I don't want to make this touch the ear necessarily because that can put some contaminant, contaminant on there. Hold on, and I'm trying to get it so you can see him too. So I know, you gotta cooperate. You've got it. Look at, now we're making a mess. So sometimes that works really well too with these guys who don't like that feeling or the sensation, is soaking a cotton ball. Come here, I know. Putting that into the ear here and then massaging that. So that is going to help kind of move that in there but not overwhelm them too much. So that works well. Good job, buddy. I know. So now that I've gotten some in there, again, I just want to massage at the base of the ear, work that cleaner down in there real good. I know. And for the cleaner, it is okay for them to shake their head a little bit, only because gravity kind of helps bring up that debris. As far as when we put the cleaner in, we do not want to let him shake any of that out. So I'm going to just keep wiping. I did already use that side, so I'm not going to use it again. I know. You're such a mad kitty. And you're probably more mad that you're soaking wet. So kind of drying them out. With his little ears, the cotton balls actually do work a little bit better. Kind of massaging that and pulling upwards, not pushing debris down in there. He really doesn't have too bad of crevices, so I'm not going to worry about that too much. Ideally, I would wait about 20 minutes before instilling medication. For purposes of this video, we're just going to move right along. Alright, so I also do not want to touch the tip of this into the ear. If that were to happen, I could just soak a little alcohol onto my gauze and clean the tips of these before reusing them next time. So directions on this are to apply a liberal amount into the ear. So I'm going to go ahead and hold that pinna again. Put a nice amount in there. Good boy. I know. And I want to massage that down in there as well. Good boy. Yes. And then I don't want him to shake that out. So if you want to massage it for a few minutes or whatever, if you have time, just kind of let that work down in there. I know. And try to prevent him from shaking, much of that out of there. So that is cleaning and medicating for a kitty cat. Alright, so for this video, I'm going to demonstrate a nail trim on a dog. Nini is going to be our candidate today for a nail trim. She is a smaller size dog. If she were larger, I'd probably use nail trimmers this size, but today I'm going to use our teeny tiny ones. The other supplies that I need are some quick stop and a little bit of gauze. And this is in case I cut into the quick of the nail, which would cause bleeding, and this is going to stop that. So I never want to actually dip the nails into this and contaminate it. I would want to pour it onto a piece of gauze separately to use if needed. Okay, so actually if you want to kind of zoom in, so when you're looking at their nails, you're looking for the quick of the nail, and Nini's lucky because she has little white nails. So if you kind of look at it here on the side, you can see all this pink right here, and then starting kind of here, you can see where it turns more whitish, opaque color. This nail is like a really good one to see a tip on it. So that's kind of where I want to aim to go. So I'm going to just trim that little tip off. For these white nails, what I'd be looking for would be a little opaque or pink dot in the middle. If her nails were black, I would be doing I'd be looking for a black dot kind of in the middle that looks soft. So I'm just trimming back a little, especially with black nails. I would go very slowly and only do a little bit at a time. So I'll just do a couple more here just to show, just taking off that little tip there and kind of going at a 45-degree angle while trimming. Okay, so that is how I would go about trimming a dog's nails, and we'll also be demonstrating a kitty nail trim as well. Okay, in this video we are going to do a cat nail trim. Some of the supplies I need are my little nail trimmers here, my quick stop, and some gauze. And these are in case you hit the quick. Luckily for cats, their quicks stay pretty short, and they do have a nice little curvature of their nail, which helps you identify where you need to cut. Ideally for positioning for them, it is nice to have them in lateral recumbency. It just gives me kind of an easy access to all the nails. If needed, they could be sternal. So I'm going to have my holder Michelle just kind of flip her over on her side in lateral recumbency here. We got our big little kitty here. Okay, and if you want to swing over here with the camera, so we're just going to show here. So in the pink here, that's the quick, and then we have that nice little white tip there. So I'm just going to, go ahead and cut those back. And cats, they can retract their front claws, so I do want to kind of push back on the top of the nail and then just kind of push on the bottom, and that helps push that nail out. It's okay, honey. So again, I'm just pushing these nails out. I'll do one more because she's kind of getting upset with me, and we're just doing this for the video. So again, pushing those nails out so I can see them. Okay, honey. Now, if I were to have quicked her, I would want to just kind of pour this onto my gauze as such and not actually dip her nails into it because I don't want to contaminate my quick stop. Okay, so that's how we would do a kitty cat nail trim. Alright, in this video I'm going to demonstrate pilling a dog. Nini's going to be my little subject here. She does not need any medication, so I'm just going to give her this little treat ball. And I do have some water for flushing the pill down after, which is important just to prevent any esophageal strictures. If a pill, certain medications sitting in the throat can cause that, and just to kind of flush that down into the stomach there. I'm going to set this here for now. Nini's a little bit of a crazy one, so I do have help with a restrainer. Some dogs are good on their own. So basically I'm going to kind of grab her somewhat near her cheekbones. Obviously being brachycephalic, she's kind of got a smushy face here. Grabbing that upper jaw, using my middle finger to push down and advance the pill back into her throat. And then she's making a little funny face there. I'm going to just kind of start flushing. Good girl, good girl. And she's taking it down like a champ. So that is how you pill a dog. Okay, so in this video I'm going to demonstrate pilling a cat. This little guy is getting a dewormer of Drontal today. So I have our tablet here. He's getting a half of a tablet. And then I do have some water here that I'm going to flush down after. It is important to flush those pills down after pilling them just to prevent any esophageal strictures that could happen. So we're going to go ahead. So basically when you're going in for it, you want to kind of hold them near their cheekbones here. This gives you a good little handle on them. Some people say you can scruff them too, and that helps relax that bottom jaw, but I do prefer this method. So I have him here. I'm going to pinch the pill in this hand and then use my middle finger to just push down that jaw and advance it back as far as it'll go. I know, buddy, I'm sorry. And I am just kind of gently holding his mouth closed. You can definitely blow. He just gave me a couple little licks, and that is the signal that he did swallow that pill. So now I'm just going to kind of follow it down with a little bit of water. I don't need to give him this entire syringe. I know, it's tricky, but just enough to kind of get that flowing down. I know, he tolerated that pretty well. Alright, so that's how we pill a cat.